going to start with a provocative statement, and I'm going to end with a provocative statement. And the statement is, papaya, or poppy, is not a legal issue. And you'll see as we go through why I say that. If you adopt the approach that you need to comply with poppy or papaya, and you're doing it just from a legal point of view, there's a risk that you're going to end up with minimum legal compliance. And that's a cost. Don't do it. Take a look at papaya as an opportunity to radically change your business, to get rid of the rubbish in your business. And when we talk about rubbish from an information point of view, get rid of the duplicates, get rid of the unnecessary information. Only keep the stuff that you should have and maximize the use of that. Once again, don't do it just from a legal compliance point of view. I'll put some perspective into context, papaya into context. I'm not here to repeat the law, but I will give a little bit of understanding as to what it looks like. Try and tie it directly into healthcare, because that's why we're here. Put an implementation plan together. If we take the core principles of poppy, you do use poppy and papaya interchangeably. You have to obtain the information fairly and lawfully. Hopefully in your space, that's business as usual. Used for the specific purpose for which you gathered it. That's often tricky. And what it does mean is we have to start understanding the information we gather a little bit better. So we have to start asking questions. What information are we gathering? What information are we keeping? And why do we need it? And how are we going to process it? And all of those questions then leads us into making sound rules as to what we're going to do with that information thereafter. Must be kept adequate, relevant, and not excessive to purpose. So only capture the information that you need. Don't gather a whole bunch of other information that's not necessary. But once again, it means asking the question, what is the purpose? Why are we gathering it? What is the reason for which we need this information? Must be kept accurate and up to date. I think for many of our organizations, this is one of the real pressing issues. How do we make sure that information is continually kept accurate and is still relevant and up to date? Must be accessible to the subject under certain terms and conditions. Kept secure. I think with cyber security and the risk of online these days, with reputation damage, with leaks of information, and especially around personal information, and especially around healthcare information, this is obviously critical. And one of our major challenges from a records management point of view is making sure that information is destroyed when its purpose is finished. And if we tie that back to the second bullet, it means understanding the purpose, how long that purpose lasts, how long we need to keep that information, and then making sure that it's destroyed once we've used it for the purpose for which we gathered it. Some implications for us means all content relating to the individual must be identifiable. So if we have information or content about a data subject, and that information is in many different forms or formats or locations in our organization, we must be able to point to all of it. We can't just be able to identify the information sitting in our databases, but we must also be able to say if we have that information sitting off-site, for example at Metrofile, or if it's a scanned-in image sitting in some electronic document and records management system repository, if we're storing it in a cloud somewhere, if we have it in various of our practitioners have that information, we need to be able to identify where it is. So having a single link to all that information to allow us to manage it as a cohesive whole is going to become critical. We've already said that the information must be deleted once the purpose is finished. And that means all the information. We can't say, well, we've got a scanned-in image and we've got a physical copy of it. Let's just destroy the physical copy. It's both personal information. The purpose for which we've used it is finished for both of those. So we need to be able to identify them, track them, gather them, and destroy all of it. And we need to interact with our clients a little bit better. And if we use client or patient interchangeably, possibly even some of our suppliers and some of our business partners in that interaction with our clients. We need to start informing people what information we're gathering, why we're gathering it. So if you're capturing information from a web form, if you're capturing it from a paper form, if you're capturing it from an interaction where somebody's sitting capturing that information in an interview, at that time, we need to have the mechanisms to inform the client, make sure they understand that they're giving us this information, how we're going to use it, and that it's going to be protected in terms of propriety. And in order to do that, we need to be able to understand how we're going to use that information ourselves. The Act does talk about special personal information, and that really refers to it's information which is just that much more sensitive, and you need to take extra care to protect that information. In our space, we think of, in addition to other information, any personal information, health information, could be biometric information, could be medical samples, anything that's specifically related to health of that individual. Anything related to their well-being, potentially their medical history, blood type, any other biometric information. If you take the approach in your world that most of the information you keep about your data subjects, your clients, your patients, is in fact special personal information, treat all the rest of your personal information the same way. Don't try and say, well, this is personal, so let's give it extra vigilance. Rather take the approach to say, well, let's treat all personal information with the same amount of vigilance. It just becomes easier to manage over time. If you think of some special processing things that you might be doing, you might have your own facilities, you might have professionals working on your facilities, you might have multiple facilities in multiple different locations, regions, provinces. You might have interaction with various stakeholders, which could include insurance companies, medical aid organizations, other partners, suppliers of information potentially, off-site storage, both from electronic and from a paper storage. Schools, where schools might have medical information or sharing medical information with you. This is not intended to be an all-inclusive list, but hopefully what we're doing is we're saying start to understand what information you gather and where that information might be used in this ecosystem, not only of your organization, but the people who work for you, who work as partners with you, and some of your suppliers and other stakeholders. We obviously, and I think it needs probably not stating in this world, but the obligation of confidentiality. It is personal information, it's sensitive personal information. We need to protect it, and we need to make the data subjects aware that we will be keeping it confidential. And as a proposal, do that by a written agreement. Every time you're gathering information from a data subject, make sure that they're aware that you're going to be treating this confidentially, and let them sign that they're aware of what they're giving you and that you're aware of your obligation. We've taken an example here of what probably happens in most of your environments today, and just to highlight some of the potential for multiple different formats and some of the things you need to consider. If we look at over here, you think of the traditional paper form. Somebody is sitting in front of your practice at your facility with a document that they're filling out in pen. And if we understand the reason why we've always used those tools, we're using it as a data capture mechanism. We're using it as a means for them to give us information. It's sitting in paper and it's in pen on paper. What normally happens is that then goes to some administrative person who takes that data and enters it into your system. So immediately, you've got that same personal information in two places. You've got it on that paper form, and you've got it now sitting in your, whatever your medical administration system is. And then we start to get clever, and we start to improve our business, and we say, well, let's scan that. So we scan that file there, that document, we scan it, and now we keep an image either in the same system or in another system. And as we're capturing that image, we're looking to capture index information such as ID number, medical aid number, name. So we've got another set of data attached to an image which is stored either in the system or another system. So think what we've got now. We've already got a paper form, we've got data, which has got some or all of that data in it, we've got an image, and we've possibly got additional data stored there. All of that is personal information relating to that individual. And now we might be sharing that with partners, associates, other companies, other regions, branches, via email, or sharing that information in some way. And what we've got to start doing is realizing where that information is. And the earlier we standardize and we limit the number of different formats we've got, the easier it is to manage it under POPI or under Papaya. So think, for example, this is a paper form. One of the immediate things we could do is convert it to an electronic form. We capture that data electronically. What that means, we don't need to manage the paper thereafter. It's stored over here directly, only one place. We don't need to scan it and index it. So immediately, just by taking that one step, we can improve our ability to comply with Papaya. So what we're highlighting here is limit the number of different formats that you've got. If we look to the obligation under Papaya to destroy information when the purpose is finished, now what we've got to do is, here we have the paper stored, we've got those images stored, and at some stage we've got to destroy it. And that means we've got to go and find it all, bring it together, destroy it, and produce evidence to say that we've destroyed it. We need a certificate of destruction. Quite complex in this environment, much easier if we only have it sitting in one system. So here's a simple approach to implementing Papaya. We've called it the 10 P's of Papaya, or the 10 P's of POPI, just because the 10 J's of POPI didn't sound quite as cute. And within that, there's lots of things we need to do. First thing is around planning. And if we go back to the first provocative statement, and we say, do this to improve the business. Let's start off by understanding what is the legislation that applies to our business. And obviously, Papaya is one of the acts. There's also things like PIA, the promotion of access to information, and many other laws that apply to us. We can't ignore the law, so we need to comply to the law. We also need to recognize that we have cost pressures. So let's ask the question, how can we improve, how can we cut costs by managing our records in terms of Papaya? How can we improve customer service? How can we get operational efficiencies by using Papaya as a catalyst? So we use those drivers to look at the technologies that we use. Then we need to put governance controls in place. And one of the first things you need to do is recognize that this is a multidisciplinary exercise. IT needs to be involved because they're handling much of that data. The operating divisions who handle interactions with customers and patients need to be involved. Legal, compliance, your risk department, records, all need to get together to make these rules. It's not a single rule that gets made by one person. And then we need to have the teams to actually make it happen on a daily basis. I mentioned understanding your information, and I'm going to just highlight here that we need to create some form of inventory. So we need to ask, what information do we have? What types of records do we have? How are they referenced and stored? How are they described? What is the retention period? Is it personal information? Which processes are we going to use it in? What formats is it stored in? Where is it stored? Can we scan potentially and destroy that paper after scanning? What sensitivity, secret, top secret, confidential classification can be allocated to it? And others. This is a lengthy discussion, so I'm not going to spend time on it. But what I really want to highlight is spend time understanding your information. We need to put policies, procedures, processes in place, and we need to be prepared to monitor and enforce those policies. It's all about change management. We are asking people to do things differently. Change management is critical. Remember the whole time it's a business issue. And governance and privacy should be, the current thinking is privacy by design. So let's see how can we design privacy into each one of our line of business processes. Don't treat it as a separate thing. Protection, safekeeping of the information is critical, underpins everything. And then let's get rid of the rubbish. Take this as an opportunity to identify where duplicate formats are kept and start getting rid of it. Use this as an opportunity to identify where you've got incorrect, inaccurate, duplicate data sitting in your systems. Get rid of the rubbish. Start rationalizing. And don't think of this as a single once-off exercise. It's a program. Take an 80-20 approach. Take a risk-based approach. Identify those things which have the highest risk for you now. Fix those. Get to the other stuff a little bit later. Recognize that tomorrow you're not going to be totally compliant. Start the journey and improve on an ongoing basis. Use technology where you can. It's not a technology issue, but technology can definitely assist. And we make the comment that electronic records management systems are almost essential. Because if you can't identify what records you've got, where they are, and be able to identify them, retrieve them, and delete them, you're going to struggle to comply with properly. So coming back to my provocative statement, don't treat it as a legal issue. Don't treat it as a compliance issue. Look at it as an opportunity to understand the information in the organization, improve that information, and improve your business by improving those information-centric processes. Use systems where you can, and use Popeye as a catalyst to improve your business. Start now. The regulations aren't out yet. We're expecting them either the end of the year or early next year. You'll have a year to comply, but that year is going to go by very quickly. We do have a couple of workshops that we're putting in place at the moment. We've got one now on the 6th of October. Start attending workshops, start understanding the detail. And there you go, attend the seminar, but also let's get talking about how to implement. Let's start the work now. Thank you.